There is something you probably did last night, and the night before, and possibly every night for years, that medical researchers have directly connected to heart attacks and strokes. And the most alarming part is that you almost certainly consider it completely normal. You might even think of it as harmless, maybe even enjoyable. But what I am about to explain could change how you approach every evening from this point forward. I am talking about eating late at night. And before you dismiss this as another vague warning about food timing, I need you to understand something. This is not about weight gain. This is not about digestion discomfort. This is about what happens inside your cardiovascular system during the hours you are asleep, and how eating too close to bedtime creates conditions that significantly increase your risk of a cardiac event. I am Dr. Kiara Walker. I have spent years studying how daily habits interact with cardiovascular health, particularly in adults over 50. And what I have learned about late-night eating has changed the advice I give to everyone who asks me about heart protection. Because this habit, which millions of people practice without a second thought, directly affects blood pressure, blood thickness, inflammatory response, and clotting factors during the most vulnerable hours of your entire day. If you are over 50, this matters even more. Your cardiovascular system at this stage of life is navigating conditions it did not face 20 years ago. Arteries have become stiffer. Blood vessels respond differently to pressure. The protective mechanisms that once compensated for occasional strain have less margin for error. And when you carry certain habits into your nighttime hours, you are stacking risks in ways that your body may not be able to absorb. Today I'm going to explain exactly what happens when you eat late, why your heart is particularly vulnerable during sleep, and what you can do starting tonight to protect yourself. This is not about perfection. It is about understanding a risk that has been hiding in plain sight. If you care about protecting your heart as you age, subscribe to Dr. Kiara Walker Senior Health so you do not miss the information that could make a real difference. Let me start by explaining something most people never learn about their cardiovascular system at night. Because without understanding this, the dangers of late eating will not make complete sense. Most people imagine that sleep is when the heart takes a break. Everything slows down. Everything rests. And while it is true that your heart rate typically drops during sleep, the reality is far more complex. Your cardiovascular system during the night is not coasting. It is actively shifting, responding to hormonal signals, managing blood pressure fluctuations, and preparing for what researchers call the most dangerous window of the entire 24-hour cycle. That window begins around 4 in the morning and extends until roughly 10 in the morning. During these hours, heart attacks and strokes occur at significantly higher rates than any other time of day. This is not random. It is biological. Here is what happens. Starting around 4 in the morning, your adrenal glands begin releasing cortisol. This is your body's natural wake-up signal. Cortisol raises blood pressure. It increases heart rate. It activates inflammatory pathways. And critically, it stimulates clotting factors in your blood. The proteins that form clots to seal wounds become more concentrated and more active during these early morning hours. At the same time, your blood is already a more vulnerable state. During the night, you have not consumed any fluids for hours. Blood naturally becomes thicker as plasma volume decreases. Thicker blood moves with more resistance. It puts more pressure on arterial walls, and it clots more readily. Now add this to the picture. Your arteries after 50 are stiffer than they were in your younger years. They do not stretch and absorb pressure the way they once did. Many people over 50 also have some degree of arterial plaque that has built silently over decades. Most of this plaque causes no symptoms, but under the right conditions, vulnerable plaque can rupture. When it does, your body sends clotting factors to seal the site. That clot can block an artery within minutes. The conditions that trigger plaque rupture include elevated blood pressure, increased inflammation, and blood that is primed to clot. Every one of those conditions peaks in the early morning hours. This is why your overnight habits are not minor lifestyle details. They directly shape whether your cardiovascular system enters that dangerous window rested and stable or strained and vulnerable. Now here is where late-night eating enters the picture. And this is the part most people have never had explained to them. When you eat a meal, your body does not simply digest it passively. Digestion is an active, demanding process. Blood flow redirects toward your stomach and intestines to support nutrient absorption. Your heart has to pump harder to maintain circulation everywhere else, while also supplying the digestive system. Blood pressure rises as a result. This is a normal response to eating, and during the day, your body handles it without issue. But at night, this process creates problems. Your cardiovascular system is supposed to be entering a recovery state. Blood pressure should be dropping by 10 to 20% compared to daytime levels. Heart rate should be slowing. Inflammatory activity should be quieting. These overnight reductions give your arterial walls a break from constant pressure. They allow microscopic damage to be repaired. They let your heart muscle itself recover from the day's work. When you eat late and then lie down, that recovery window never fully opens. Your body is still processing the meal. Blood pressure stays elevated. Your heart is still working harder than it should be during sleep hours. And the metabolic effects extend further than most people realize. Your body processes food differently at night. This is not opinion. It is circadian biology. Insulin sensitivity decreases in the evening hours. The same meal that your body handles efficiently at noon requires significantly more metabolic effort at 9 or 10 at night. Blood sugar rises higher. It stays elevated longer. And sustained elevated blood sugar, even in people who do not have diabetes, damages the endothelium over time. That is the delicate inner lining of your arteries, the layer responsible for keeping blood flowing smoothly and preventing dangerous clots. There is also a direct mechanical issue that affects the heart when you lie flat after eating. Your stomach is working to process food. Pressure increases in the abdominal area. For many people, this leads to acid reflux, which most dismiss as merely uncomfortable. But the vagus nerve, which runs alongside the esophagus and connects directly to the heart, can be stimulated by esophageal acid exposure. This stimulation can trigger irregular heart rhythms. People who experience heart pounding or skipped beats after a late dinner often have no idea the two are connected. Now let me explain a factor that quietly multiplies all of these risks, and it is something most people completely overlook: sodium. The average dinner, especially restaurant meals, takeout, and processed convenience foods, contains far more sodium than most people realize. A single restaurant entree can contain 2 to 4 times the amount of sodium that would be considered heart protective for an evening meal. And sodium consumed at night has a specific cardiovascular consequence. When you consume high sodium in the evening, your body retains fluid to balance it. This fluid retention increases blood volume. Increased blood volume raises blood pressure through a direct mechanical effect. This elevation does not resolve quickly. It persists through your sleep hours and extends directly into the morning cortisol surge. So now picture what is happening. You have eaten a large meal late in the evening. Your blood pressure is elevated from digestion. You have consumed significant sodium, causing fluid retention that further raises blood pressure. Your blood sugar is elevated and staying high longer because of reduced nighttime insulin sensitivity. Inflammatory markers are active because eating triggers an immune response as part of normal digestion, and your body is trying to do all of this while you are lying flat, which changes blood distribution and increases cardiac workload. You fall asleep in this state, and while you sleep, your blood is gradually becoming thicker because you are not taking in any fluids. By 4 or 5 in the morning, the cortisol surge begins, blood pressure climbs further, clotting factors activate, inflammation increases, and your cardiovascular system, which never got the recovery window it needed, is now facing the highest risk hours of the day in a compromised state. This is not an exaggeration. This is the physiological reality of what late-night eating does to your heart. And when this pattern repeats night after night, the cumulative strain becomes significant. If you are finding this information valuable, take a moment to hit the like button. It helps more people find this content, and it tells me you want more straightforward explanations like this one. Now let me go deeper into the sodium issue, because there is something specific you need to understand about how sodium timing affects your cardiovascular system differently than sodium consumed earlier in the day. Your kidneys are responsible for managing sodium balance in your body. When sodium levels rise, your kidneys work to excrete the excess. But this process takes time. Sodium consumed in the morning or early afternoon has hours to be processed and balanced before you go to sleep. Sodium consumed at dinner, especially in large amounts, is still being managed while you are lying down. Your body is holding on to fluid to dilute it. Your blood volume is expanded. and your blood pressure reflects that expansion throughout the night. Researchers have found that people who consume the majority of their daily sodium in the evening hours have higher nighttime blood pressure readings compared to those who consume the same total amount but distribute it earlier in the day. This matters because nighttime blood pressure is one of the strongest predictors of cardiovascular events. People whose blood pressure does not drop appropriately during sleep, a pattern called non-dipping, face substantially higher risks of heart attack, stroke, and cardiovascular death. Late-night eating, especially high-sodium eating, directly contributes to this non-dipping pattern, and most people have no idea their evening meals are affecting their blood pressure while they sleep. Now I need to explain another connection that makes late eating even more concerning, and this involves what happens to your blood itself during the overnight hours. When you eat a heavy meal close to bedtime, your body directs significant resources toward digestion. This metabolic work generates heat. Many people notice they feel warmer after a large meal. This warmth leads to fluid loss through the skin, even if you do not notice yourself sweating. At the same time, you are not drinking anything while you sleep. The combination of metabolic fluid loss and zero fluid intake causes your blood plasma volume to decrease as the night progresses. When plasma volume drops, your blood becomes more concentrated. The red blood cells, the clotting proteins, the inflammatory markers, all of them exist in a smaller volume of liquid. Your blood is thicker. It moves with more resistance through vessels that are already less flexible after 50. Your heart has to work harder to push this thicker blood. And because clotting factors are more concentrated, your blood is more prone to forming dangerous clots. This natural overnight thickening is something a healthy cardiovascular system can manage. But when you add a heavy late meal, elevated blood pressure, fluid retention from sodium, and then compound that with the morning cortisol surge activating clotting factors further, you have created conditions where clot formation becomes significantly more likely. If you had alcohol with dinner, the effect multiplies again. Alcohol is a diuretic. It suppresses the hormone that tells your kidneys to retain fluid. You produce more urine. You lose more fluid, and your blood thickens faster than it would otherwise. Many people over 50 enjoy a glass of wine with dinner, and I am not here to tell you that is forbidden. But the timing matters. Alcohol consumed close to bedtime accelerates the blood thickening process during exactly the hours when your cardiovascular system is most vulnerable. This is where I want to share what research has actually shown, because this is not speculation. These patterns have been studied extensively. Large observational studies have found that people who eat their largest meal late in the evening have higher rates of cardiovascular disease compared to those who eat earlier. Research published in major cardiology journals has shown that meal timing affects not just weight and metabolism but also blood pressure patterns, inflammatory markers, and arterial function. One study examining thousands of adults found that those who consumed more than 30% of their daily calories after 8 in the evening had significantly higher cardiovascular risk markers compared to those who finished eating earlier. Another line of research has shown that the body's circadian system, the internal clock that regulates nearly every biological process, directly controls how efficiently you metabolize food. Eating out of sync with this clock, which late-night eating does by definition, creates what researchers call circadian misalignment. This misalignment has been linked to higher blood pressure, worse blood sugar control, increased inflammation, and elevated cardiovascular risk. Clinical observations have reinforced these findings. Doctors have long noticed patterns in when cardiac events occur. The morning clustering of heart attacks and strokes is well established. What has become clearer in recent years is how nighttime habits, including eating patterns, influence whether someone's cardiovascular system is prepared for that dangerous window or vulnerable to it. So what should you actually do with this information? Let me give you practical steps you can apply starting tonight. The simplest and most effective guideline is what I call the 3-hour rule. Finish your last substantial meal at least 3 hours before you plan to go to sleep. If you typically go to bed at 10, aim to finish dinner by 7. This gives your body enough time to complete the most active phase of digestion before you lie down. Your blood pressure can begin its normal nighttime decline. Your metabolic processes can settle, and your cardiovascular system can actually enter recovery mode. If your schedule makes early dinner difficult, there are adjustments you can make. First, reduce the size of your evening meal. A smaller meal requires less digestive effort, causes a smaller blood pressure increase, and processes more quickly. Think of dinner as your lightest meal rather than your largest. Many cultures historically ate their main meal at midday and had something light in the evening. There is cardiovascular wisdom in that pattern. Second, pay attention to what you eat in the evening. Lean proteins and vegetables digest more easily than heavy, fatty meals. Reduce sodium deliberately at dinner. Cook at home when possible so you control the salt content. When eating out, ask for sauces on the side. Skip the bread basket. Choose grilled options over fried. These are not dramatic sacrifices. They are targeted adjustments that directly reduce overnight cardiovascular strain. Third, manage your fluid intake strategically. Drink water consistently throughout the day so you enter the evening well hydrated. Then have a small glass of water, perhaps 6 to 8 ounces, about 60 to 90 minutes before bed. Not right at bedtime where it might wake you for the bathroom, but early enough to contribute to overnight blood volume and prevent excessive blood thickening. If you regularly wake with a dry mouth or feel dehydrated in the morning, your evening hydration is insufficient. Your body is telling you something. Listen to it. If this is making sense and you want more practical guidance like this, share this video with someone over 50 who needs to hear it. The people in your life deserve to understand these risks too. Now I want to briefly address some additional nighttime habits that multiply the risk when combined with late eating. Because cardiovascular strain during sleep rarely comes from a single source. Alcohol timing matters, as I mentioned. If you choose to drink, finish your last drink at least 3 to 4 hours before sleep. This allows your liver to process the alcohol and reduces both the blood pressure rebound effect and the accelerated dehydration that alcohol causes. Room temperature affects your cardiovascular system more than you might expect. A warm bedroom prevents your body from achieving the core temperature drop that triggers deep restorative sleep. Your heart rate stays elevated. You may sweat, losing additional fluid. Aim for a room temperature between 60 and 67 degrees Fahrenheit for optimal cardiovascular recovery. Your sleeping position can also matter, particularly after eating. Lying flat immediately after a meal increases the likelihood of acid reflux, which, as I explained earlier, can trigger heart rhythm disturbances through vagus nerve stimulation. If you must eat closer to bedtime than ideal, consider sleeping slightly elevated or on your left side, which can reduce reflux and ease cardiac workload. The key concept I want you to understand is cumulative overnight load. No single factor may seem alarming on its own. A slightly late dinner, a glass of wine, a warm bedroom, a high-sodium meal, but when these factors stack together in the same evening, they compound. Your cardiovascular system faces a combined burden that is far greater than any individual element would suggest. Reducing even 2 or 3 of these factors meaningfully improves your overnight cardiovascular profile. Let me give you realistic expectations about what happens when you make these changes. Most people who shift to earlier, lighter dinners notice improvements within the first week. Sleep often feels deeper. Morning alertness improves. That uncomfortable fullness or restlessness at bedtime disappears. Within 2 to 3 weeks, many people notice that their morning blood pressure readings begin trending lower. This is a meaningful sign that your cardiovascular system is recovering more completely during the night. If you have been eating late for years, do not expect overnight transformation. Your body needs time to adjust. But the cardiovascular system is remarkably responsive. When you reduce the overnight load, it moves toward balance faster than most people expect. Consistency matters more than perfection. Even shifting dinner 30 minutes earlier and reducing sodium moderately creates measurable benefit over time. I want to be clear about something important. What I have shared today supports your cardiovascular health, but it is not a replacement for medical care. If you have been diagnosed with heart disease, high blood pressure, or any cardiovascular condition, continue following your doctor's guidance. Do not stop any prescribed medications based on this information. These lifestyle adjustments work alongside medical treatment, not instead of it. If you experience symptoms such as chest pain, shortness of breath, or irregular heartbeat, whether at night or any other time, seek medical evaluation. Understanding these risks is empowering, but professional care remains essential. So let me bring this all together with the clearest takeaway I can give you. Your heart faces its greatest physiological challenge in the early morning hours. What you do in the hours before sleep directly determines whether your cardiovascular system enters that window recovered and resilient, or strained and vulnerable. Late-night eating raises blood pressure during hours when it should fall. It thickens your blood when it is already prone to thickening. It elevates inflammation when recovery should be occurring. And it combines with the natural morning cortisol surge to create conditions where cardiac events become more likely. The 3-hour rule is your simplest protection. Finish eating 3 hours before bed. Keep evening meals smaller and lower in sodium. Stay hydrated throughout the day. And be aware that other habits, alcohol, warm rooms, and lying flat after eating, can multiply the risks. Tonight, you have an opportunity to do something different. Not a dramatic overhaul. Just one meal, finished a little earlier, with a little less sodium, followed by adequate hydration before bed. That single evening creates a slightly safer night for your heart. String enough of those evenings together, and you are building real cardiovascular protection. Your heart has been working for you without pause for your entire life. During the hours when it should be recovering, give it the conditions it needs. This is not complicated. It just requires understanding what is actually happening inside your body, which you now have. If you want more clear, practical health information like this, subscribe to Dr. Kiara Walker Senior Health and turn on notifications. In my next video, I will explain what happens during the first 30 minutes after you wake up, and why certain common morning habits are putting additional strain on your cardiovascular system during the highest risk hours of the day. Leave a comment and tell me what time you typically finish dinner. I read every response, and your experience helps others in this community recognize patterns they might be missing. Take care of your heart tonight. It has never stopped taking care of you.